virus that is more easily transmittable now. We know that Delta virus is much more contagious. And so if you don't have the barrier of vaccination to prevent the immunity of vaccination to prevent COVID Delta coming into you, if you don't have a mass barrier to prevent Delta from coming into you, then you're going to have more people who have Delta COVID cases. And there, by sheer number of more cases, there will be a percentage of them that actually have sicker cases, including in younger patients. And that's exactly what we're seeing in the pediatric population. Now, does that mean that the Delta is much more severe in children than, say, earlier variants, for example, original Wuhan or Alpha, Beta, Gamma, et cetera? And the answer is we don't fully know yet. But remember, it's just all about numbers. If you have a million more cases, for example, you're going to have a proportionate increase in the number or percentage of severe cases. And that's really what we're dealing with regard to the pediatric population. And so those numbers themselves have actually overwhelmed our children's hospitals, for example, primary children's, just by sheer nature of volume of cases, which is why you see the emphasis on trying to prevent transmission in a population that can't be vaccinated yet. We're hoping that changes soon with the 5 to 12-year-olds in particular. And we expect that to come. But right now, that's why it's so important to actually decrease the risk of transmission in that population. And the way to do that is not just from preventing with our measures of distancing and masking, but also making sure that all family members in families where they have pediatric population get vaccinated. So we stop the likelihood of transmitting COVID within that family and to that child.